Patient safety is defined as any unintended or unexpected incident which could have or did lead to harm for one or more patients receiving NHS-funded care, and is a concept that has grown in importance in the last decade. Advances in patient safety are now seen as central to health service improvement in this and other countries. It is also clear that the concept is particularly relevant to older people with diabetes, and we know that the number of older people with diabetes will grow significantly in the next decade. It is clear from a patient safety perspective that older people with diabetes are a particularly vulnerable group. The evidence indicates that patient safety incidents are more common and dangerous in the elderly population. They are, to put it simply, an at-risk group. Being diabetic adds further to the risks faced. The increased risks are linked to the likelihood of multiple pathology, polypharmacy, reductions in the ability to understand and interact effectively with healthcare staff, and the delicate balance to be achieved in terms of matching lifestyle changes and drug therapy to maintain optimum blood glucose management. The complications associated with hypo and hypoglycemia further add to the risks. The last decade has seen a shift away from an emphasis on individual practitioner responsibility in terms of reducing errors and other types of patient safety incidents towards the identification and utilization of system solutions. It is the effective creation and utilization of safer systems that improves patient safety. Policy, procedure and guidelines. Practitioners should establish and utilize effective and agreed policy and procedure, including national guidance on diabetes care and treatment. Patient safety incident reporting. Evidence from the National Reporting and Learning Service shows that general practitioners are reluctant and infrequent reporters. The NHS needs more reporting data on which to judge and implement improvements to the care and treatment of these people, so please increase your reporting. Medication reviews. People with diabetes are inevitably frequent users of healthcare facilities, and their medication regimes are likely to change over time. Regular medication reviews are therefore essential, especially when the risks associated with polypharmacy are added. From compliance to concordance. Expecting patients to be fully compliant with the medication regimes given to them is known to be a flawed approach. Endeavour to enhance concordance by getting the patient or their carer actively involved in medication management, and check what they actually do with the medication as opposed to believing that they do what you ask. Active patient care involvement improves patient safety. Error wariness. The older person with diabetes belongs to an at-risk group, and acknowledgement of this by practitioners may give them the foresight to anticipate or intercept patient safety incidents. You should see older people with diabetes as a vulnerable group within the context of patient safety. To conclude, across the NHS we need to achieve significant improvements in patient safety, and older people with diabetes should be seen as an at-risk group in terms of their management and treatment. Where possible, seek to promote concordance when negotiating diabetes management with these people, and actively seek to enhance patient carer involvement. Check that your policies and systems are robust, that you and other staff adhere to these, and ensure the completion of regular medication reviews. Finally, please increase your reporting of patient safety incidents, including near-miss events.